Knee-jerk reflex, also called patellar reflex, sudden kicking movement of the lower leg in response to a sharp tap of the patellar tendon, which lies just below the kneecap. The sharp tap on the tendon slightly stretches the quadriceps, the complex of muscles at the front of the upper leg. In reaction, these muscles contract, and the contraction tends to straighten the leg in a kicking motion. Exaggeration or absence of the reaction suggests that there may be damage to the central nervous system. The knee jerk can also be helpful in recognizing thyroid disease. Achilles reflex. The examiner strikes the Achilles tendon with the patient in a supine position with the knee flexed and the hip externally rotated on the examination table, or you can be seated down in the examination table. One hand is slightly dorsiflexing the foot from the plantar aspect, as the other hand holds the reflex hammer. The Achilles tendon is struck directly with the reflex hammer, and a positive result is when the calf muscle contracts and the foot plantar flexes. The other techniques for performing the Achilles reflex are as follows. The plantar strike with leg dangling and with leg elevated. These techniques are mostly done by neurologists and not commonly performed.
The jaw-jerk reflex has bent the temporalis and masseter muscle on their side when the patient clenches their teeth. Ask the patient to open their mouth and repeat this against resistance. Observe for any deviation of the jaw on one side.
Brachioradial reflex is observed during a neurological exam by striking the brachioradial tendon and its insertion at the base of the wrist into the radial styloid process, radial side of the wrist around 4 inches proximal to base of the thumb, directly with reflex hammer when the patient's arm is relaxing. This reflex is carried by the radial nerve, spinal C5 and C6. Biceps reflex. The test is performed by using a tendon hammer to quickly depress the biceps brachii tendon as it presses through the cubital fossa, especially the test activities that stretch receptors inside the biceps brachii muscle, which communicates mainly with the C5 and C6 spinal nerve, and to introduce a reflex contraction of the bicep muscle and jerk of the forearm. Triceps reflex. The test can be performed by taping the triceps tendon with the sharp end of a reflex hammer while the forearm is hanging loose at a right angle to the arm. A sudden contraction of the triceps muscle causes extension and indicates a normal reflex. Hoffman's reflex test itself involves loosely holding the middle finger and flicking the fingernail downward, allowing the middle finger to flick upward reflexly. A positive response is seen when there is flexion and adduction of the thumb. The palmometal reflex consists of the twitch of the chin muscle elicited by stroking a specific part of the palm.
The glabellar reflex consists in repeatedly tapping the patient between the eyebrows, causing them to blink. The Babinski reflex occurs after the sole of the foot has been firmly stroked. The big toe then moves upward or toward the top of surface of the foot. The other toes fan out.
Oppenheim signs is dorsiflexion of the great toe, consisting by the irritation downward of the medial side of the tibia. It is one of the number Babinski-like responses.
Rooting reflex, a reflex that is seen in normal newborn babies, who automatically turn the face toward the stimulus and making sucking motions with the mouth when the cheek or lip is touched.